That one piece of equipment, it's $75 from Amazon. We order it, set it up, assemble it, train you on it for $160. But most folks were educating saying, here's the link on Amazon, go to it. Or go to Long Street to the Masonic Lodge, Robert Allen Health Center, and pick one up for no charge. Um, that's the thing that can prevent us pulling out the entire system, which we do. And then a barrier-free shower is the more aggressive, where it's flat. But that one over to the right, that prevents that. That makes it so you don't even need that. Now, the bench to the left, the blue one, that's going to be a little more mechanical in nature, where if the individual cannot swivel, I hate to minimize any effort. If the individual cannot swivel on their own and then slide on their own, that blue one is 2 buttons away from that. So that there's a lever that swivels them, and then there's a lever that slides them into the situation. So and it also is padded, has armrests and a seatbelt. So that's another option as well. But this one to the gray one is just the gold standard if someone can maneuver. And then coupled with this is a little bit more of a moderate approach, which is it's about a $1,200 out-of-pocket charge, but this cut right here supplements the tub bench, or some folks, if they're ever considering pulling out their tub and putting a walk-in shower that has a 4 to 6 inch lip, we'll do that, but that's still going to be a $14,000 project. We're happy to offer the cut where that arrow is right now, where Deb's arrow is. That cut can take 8 inches from that tub wall in the matter of a couple hours. And then it's as if they did the walk-in shower for a fraction of the cost. So that's really a game changer in modifications. For years and years, that's the extent of demo that we did. And now we're offering, it's a different link on the website. It's the barrier-free shower link, but that's the game changer. If folks simply cannot transfer, then they need, and it's more, maybe it's more of a luxury for some folks, but it's that barrier-free. You can roll in or you can walk in without lifting your leg. I can put the link there too.
Dustin, what are some of the ways
Yep.
that people can get this stuff paid for? You had mentioned the
Yeah.
Masons so that
Yep.
you can get stuff
I'll dive
that's
into that
donated.
now. Yeah, let me dive into that. Um, Equipment like shower chairs that we may talk about during an assessment, tub transfer benches, even patient lifts, sit to stand lifts, certainly hospital beds. It's on Long Street in Warwick. It's the Robert Allen Equipment Exchange, and it's only open Fridays from 9 to 12 because it's all volunteer based, but you can call at any time and put in your request of equipment. They have a large warehouse where you go and you can pick up whatever you want, and it's on a lifetime or as needed loan. So you have it for no charge for as long as you need it. All they ask is for the sustainability of the program. If there's ever a time and there's no why or what happened or this or that, it's if there's a time that that equipment is no longer needed and is going to otherwise go in a basement or a dumpster, please bring it back. They ask you to attest to that. And that's truly to the sustainability of the company, of the organization for years. Since we started, they've helped. Now, aside from that, Lions Clubs down here in Narragansett has a nice little loaner closet that we have set up. Elks Lodges have some programs. Funeral homes. Ask your local funeral home about those programs. Most of them have families that have just gone through crisis. They lost a loved one. They have this equipment and they give it to them, and they give it to the local funeral home, and they have it. And then on the flip side of it, it's spouses that are going in for help. sometimes have the need for said equipment. So it's a very unique outside the box resource. Some churches will have it, have options. Your local senior center, potentially will know of the church or the funeral home that may have stuff. Um, that's the loaner closet kind of DME type best option. Also, who spoke, I believe, last month, is a tremendous resource. When we created the company, they were our first call on my little legal pad of outreach of letting folks know who we are and that we wanted to create partnerships and find out about every resource on the planet that could help our folks. And they were the number one call. And now we're contractors with them. So we love to scream from the rooftops. And I think over the years, they've done a great job of educating folks that companies like us are not competition, but we're straight up partners. And we're one and the same, whereas they go out and fund the project, assess the project. We're simply a contractor in that situation. And we take off our OT assessment hat and we keep only the contractor hat on in construction. And they tell us what to install and we install it. So we work very nicely with them. And it's that private pay situation that I can speak on further. Conservative or aggressive. It's the above and beyond the most aggressive, most active funding source we have is we don't walk into a home without educating folks on it. It's the Rhode Island Livable Home Modification Grant Program. It is a leader nationally, and like it's becoming like a gold standard in funding for home modifications. Massachusetts, we have it on the finish line. It's in the Ways and Means Committee to be a law there. It's now a permanent part of the state budget in Rhode Island. It's been robust for the last 6 years. What it does is reimburse 50% of anything someone pays a contractor for work that we do, or any contractor. It doesn't have to be us. I think about 90 to 95% of the applications go through our office. That's just because we love it so much, and we go to 10 to 12 houses a day to start the process with them, and we don't leave the home without at least educating them about the grant. There are income limits. You can make most folks laugh at us and say, of course we qualify, or of course mom qualifies. You can make up to $78,700 per year and qualify. And that doesn't mean household income. That means individual income, which it really blows people away. It's the Medicare population that has been told no to funding their entire life for everything. Working class folks that make ends meet and now are retired. Maybe have they a small pension that they've earned and Social Security, of course, but it's nowhere near 78,000. And they're shocked that they qualify. They say, "Oh no, I don't qualify, my pension," or between the two of us, we filed jointly, no chance. They look at both, but they only identify the one income, what that contribution was. If it's less than that number, you get a smiley face on the application on the worksheet, and you can proceed. That is one homework assignment, the proving on the taxes. Homework assignment number 2 is many folks on this call may be eligible. A qualified professional, meaning a licensed healthcare provider, so OT, PT, PA, NP, doctor, physician, or nurse, can sign off saying they have to attest that this equipment that we're trying to get installed or trying to get covered will help them live safely and independently in the community. I tell everyone it's not a Corvette we're trying to get them. It's moral, it's ethical, it's legal, it's lovely. Most times the folks signing off on it are the ones that gave, our rat card in the first place, saying, call those folks to see what they can do for you. So we haven't had a therapist yet not sign off on it, because it's completely legitimate. Other than that, I hate to minimize applications or anything, but I think everyone on this call, I think are paperwork folks, looking at all the titles here. So I hate to minimize it, but with your help, this is not a challenging application. Aside from the 2 homework assignments I mentioned, they're putting their name and address on it about 5 or 6 times. And it's we take care of the contractor page, which is sending the formal quote that identifies the cost of the project to the state on their behalf, and then all the before photos to the state on their behalf, identifying that modifications have not been made. On the back end, well, I should say, once they submit the application, 5 days later, you can call Barbara and say, please tell me I'm approved. I promise you, it's the income verification is the only way you will not be approved. We will not submit anything if it's not an approved project. They do go by ADA. That as far as ramping goes, they need certain 1 to 12. We don't need to get into the weeds about the ramping math, but an equivalent to any public access ramping, rise to run, is what they require for the grant. So what it really does is just make a safer system for the folks, when otherwise, without the grant, we can make them a little steeper, but not tremendously.
With that
Yeah.
home modification
Yes.
grant,
Yep.
5-day turnaround, which is pretty amazing for
Yep.
any state program application.
Unbelievable.
And they'll cover up to a certain dollar amount. So they
Yes,
won't cover
fair.
the whole project. What is that current dollar amount? And is that grant something that can be applied for regardless of the person's age? Like if somebody got into a car accident, God forbid, tomorrow,
Yep.
could they apply for this if they were younger?
Yes, absolutely. We've had 20 somethings apply for this. We've had children apply for this. But the main question about the first question about the threshold, yes, it's 50% of a lot of, like, so if it's under a $9,000 invoice, it's purely 50%. So it's no roundabout. It's 50% up to $4,500 back to the person. So if it's a $10,000 invoice, $4,500 is that cap. But anything under $9,000, $8,000 invoice, $4,000 comes back. It is cut and dry. It's black and white, 50% until you hit that $9,000. So everything I talked about, as far as grab bars, handrails, even the cutout, you're nowhere near that threshold. So you can expect 50% back. And then
Okay.
on the other end of the spectrum, the barrier-free shower, the pulling out their existing unit, putting in a whole new flush to the floor system, that's well over 9,000. So it's just a guaranteed $4,500 coupon. So that the folks that are going to make that $14,000 investment, that's a $4,500 couple hours of paperwork, or minutes really. So yeah, it's very robust. It's a fantastic program. So many folks don't think they qualify, and then they do. And then if a lot of folks don't have loved ones, or even folks that do have loved ones that can take care of the paperwork, 9 times out of 10, they're calling our office. We offer formal application assistance. We will go word for word, line by line, page for page with this. We have their copy of their quote. They have the copy of the quote. Everything's in order. We guide folks through it because we work with the grant all day, every day. Everyone in our office first name basis with Barbara Palazzo at the state. She runs a great show over there, and she's helping thousands and thousands of people. Rhode Island has given us the data because we needed to take it to the leadership in Massachusetts. So they compiled a lot of data for us. They believe there's $8 million a year in nursing home cost divergence that would have been otherwise state Medicaid because of this grant. And that's only
huge.
building. It's huge. Every year when we first started screaming this grant from the rooftops, first 4 years, about halfway, 3/4 through the fiscal year, we got the tough call from Barbara saying, you've used all the funds. Great job. That's what grants are supposed to do. You're supposed to use them. but it was only three-quarters of the way through the fiscal year. And from that point forward, until it was refunded and revoted on, folks would be at a wait list. When the ARPA funds were available, American Rescue Plan, the state asked for proposals from organizations to what to do with these $2 billion that Rhode Island had. Out of every organization in the state, every company, anyone that cared about anything to get money, we were one of 30 proposals that were officially on the state. It got listed. I think we were the fourth one to submit. I think it was a 35-page presentation. Never got that call again. And our proposal was to use any amount of funds, even $1 million, which to that 2 billion is nothing. Small percentage, I should say, towards the grant. We've never gotten a call that the funds were out in a fiscal year since. So that's the last 3 years since ARPA. And I think they gave us a whole million, if not 50, $1.5 million, because now our volume is twice as much as it's ever been. And the people are using the grant. So I think there could be $2 million. There could be $2 million. They won't tell us how much, but we've never gotten the call that it's out. So
That's good, because there used to be a rumor that that program would run out of money early on in the year. So it's good to know that one is fully funded finally.
They've doubled down or tripled down, and it's not for lack of popularity or use that we didn't get that call. And we just this past week we reset and we're in the new fiscal year, and it's as robust as ever. They didn't even send us an updated application. They've sent applications a lot because of questions that we bring to the table, and they're humans. And it's a human written, so humans can amend it when, hey, what about this stipulation? What about this kiddo? Now it's written that kids can be it because we brought the question that can this child have it, So, it's independent of insurance. That's the best part, where it's really address and home base. The state is really sneakily, they're trying to simply improve the housing stock in Rhode Island, because on a national level, we have the second oldest housing stock because we're old as a land. We were in the first states, we were new, we were old. So
you bring up a
Yeah.
good point about insurance.
Yeah.
Are home modifications something that a long-term care insurance policy can cover?
Awesome question. Yes, it's on our intake. We ask it. Not everyone will have it, but if folks have it, they know they have it because they've been paying a premium since you or my, our age, Deb. Like that's when the wealth managers, that's when the policies want to sell them. So it's generally someone that was doing well in their lives and said, yes, I can afford $5,000 a year to hopefully never use. And to never need, and here's the eye-opening thing, Deb. Most folks look at it as nursing home insurance. Whereas, yes, if you need to go to a nursing home, you're covered because you've paid your weight in gold over the years for that stay. We're educating folks that it can be aging in place insurance because they can use the same claim with a long-term care policy for care in the home. CNA care in the home to keep them there, and $7,000 in a claim period for our equipment, which we can do a lot of stuff for $7,000.
Wow.
So folks can use their policy, and they can't just carry the policy. They have to be in a claim period. So using their policy, meaning the qualifiers are simply, I think it's 2 out of the 5 primary ADLs, which transfers from point A to B is one of them. So most folks that call us have trouble with transfers. The other one can be showering. Like you can justify a lot of people need help, like some supervision in the shower. Or if they need help getting their socks on, that's dressing. So, and it's care teams that are doing that. We're not any part of that assessment. We are.
But those are the things that can trigger the insurance to be able to cover the modifications.
And more importantly, a claim can be opened where they can get the, let's be honest, I defer. Remember, I said we're one piece of the puzzle. The care in the home can be more important than our equipment.
Yeah.
I will defer. Some of our greatest partners are home care companies. I defer to them. If you have to prioritize, someone helping you in the shower is more important. That we can get into the weeds about that, but it's all synergy. It's all works
Right.
together. But the long-term care policy, it's that first step is getting the care in the home.
Yep.
And then the silver lining is, hey, all this equipment you called me in for can be covered under your long-term care policy.
So if there's something that you get diagnosed that's
Yes.
progressive, like
Yeah.
MS or
Yep.
ALS
Yep.
or something like
Parkinson's.
that,
Yep.
Parkinson's, are there programs because of your diagnosis
Yeah.
that can help pay for modifications?
100%. Fantastic question. It's almost like you're reading at my website.
I'm
So
actually not.
it's disability, or that you have read. Disability organizations. So when we first created the company, along with OSL, our calls were, okay, let's identify those diagnoses that have a large support population, a support group, associations, and it's very simple on an outreach. I've made it very simple. You call the organization. First question, do you have funding for home modification for your members? 90% of the time, the answer was no. The 10% of the time that it was yes, that's fantastic. What do you cover? How do they access the funds? Who do they call? Where's the application? So since then, MS Society, Greater MS Society in New England, $4,000, $5,000 of funds readily available for folks with MS. ALS, locally here, Rhode Island, it's ALS United, they call themselves now. They've rebranded nationally. $1,500 right off the rip. Ramp, they have a whole ramp program that we guide folks through. Completely covered ramp, doesn't even go towards your $1,500 benefit. Polio, there's been a huge uptick in return of polio. You get thousands of dollars. It's a Rhode Island, you would never know. Rhode Island Infantile Paralysis Association, thousands of dollars available for these folks. Parkinson's, they have several $100s available per issuance. More for them. They're focused on the research. So to when I get the 90% of the time, no, we don't have funding for home modification. Our follow-up is, okay, what benefits do you have? Because we're going to engage with folks anyway. And whether you have home modification funding or not, we're going to send them your way. So they're more guided on research and support elsewhere. It's companionship. They offer a lot. So great question. And we'll even encourage folks as our volume raises and we're finding out about new organizations all the time or new diagnoses all the time, new conditions. We'll challenge the family and say, do you have a support group? Is there an association that you're aware of? And they say, oh, yeah, there's this group out in Boston that we go and visit. I say, call them, ask, and we give them a script. Do you have funding for home modifications? And they uncover a lot. Oh, well, you have miscellaneous rainy day funds. It's not necessarily earmarked for home modifications, but that fits within the box. It's going to help you live at home. Great. And it's just eye-opening. And then we'll add it to our website and we'll make it part of our talking points when we're engaging with folks and resources.
One of the things
Yep.
too, for folks who live in the more rural communities,
Yep.
I know it is really challenging to get help. So getting
Yep.
those modifications might really be your only opportunity to stay home.
Yep.
How about the U.S. Department of Agriculture?
Yes, they absolutely have funding. It's more of a longer process that we are not part of. It is through the city and the town. So go straight through the township, through the town hall, the clerk's office. They can really guide through that. Cheryl screams it from the rooftops. All those opportunities. It is longer process to get those grants, but they're 100% covered and they're out there. Towns like Hope Valley, out in Charahoe, Richmond, they've got a lot of rural development type grants that are out there. Certainly reaching out to your town and asking about stuff like that. Any grant that they're involved with, anything that they need. I mean, so far for those types of grant programs, It's only been quotes that they need from us, which we're happy to share quotes with anyone. We want to scream it from the rooftops, the options that are available to help with funding. One other one I have to make note of, because I know it's so near and dear to your heart, Deb, is the VA. We're opening folks' eyes about the VA daily, and we're not even contracted directly with the VA. So the VA doesn't pay us any money for any job. However, we're the very top contractor on the VA list when they're not, the veteran's not eligible to go directly through the VA. And when it's a referral out, we're on the top of their list. There's a HISA program, Home Improvement and Structural Alteration. That can be any contractor, and we're certainly on the top of the list for preferred vendors there. Railings, those barrier-free showers that I talked about, they can be up to $6,800 reimbursed. That's a lifetime warranty for a veteran if they're 100% disabled, tour related, or excuse me, service related. I don't like to speak too much about the different levels, but we have a full script and a full guide piece where folks, if they have, or even if they haven't been taking, most often they haven't, but even if they have, I should say, been taking advantage of their VA benefits, meaning going to the VA for primary care and different appointments, we have a full script of exactly what they need to ask. If it's ramps, stair lifts, or oftentimes grab bars, they go directly through the manufacturers and they put it out to bid. We may very well not be the company installing it, but what we tell directly, look the veteran right in the eye and say, we don't care. As long as you get the right equipment, we don't care who does the work. We're happy to educate you that the program exists. And so we have some of the most grateful folks are the folks that we don't do any work for. We've just pointed them in the right direction, and more than point, we've literally guided them directly in the right direction. So I see the Calling All Veterans thing. That's an incredible resource as well. Again, we're one little piece of the puzzle. The veterans benefits, the modifications, one little piece of their offering. Deb educates, I think, daily on the wide variety of resources out there for veterans. So veterans, the VA Medical Center, tough reputation sometimes that I think Deb works tremendously hard to break down the stigma, to a full reset on the stigma and the judgment. They've come a long way. The programs are robust. They're responsive. Yes, things take time, but it's all justified, and you're not falling through the cracks anymore. We've got the right contacts for you, and the right programs, the right verbiage to use to get the benefits that you deserve is what we say to the veterans. We say you deserve this, and now there's a lot of programs available for you. It all starts with arranging a primary care visit to get the party started, really.
And when it comes to the veterans, I just want to interrupt real quick on the veterans.
Please.
If you have a client who is in their 90s,
Yeah.
it doesn't matter male or female, ask if they served or if they are a spouse of those who served, because from a historical perspective, people who are in their 90s at that time frame, most men deployed to World War II and came home with scars, with disabilities. And what can happen when that individual has a service-connected disability, their spouse can also be eligible for resources through the VA. So if somebody's in their 90s, automatically ask. If somebody says that they served and have not applied for benefits or seen if they were eligible for anything since August of 2022, that's when the PACT Act went through. Tell them to go reapply. They can do that through the VBA. They can do it with the VFW, the Rhode Island Office of Veteran Services.
Right.
Because once they have that disability rating, then the VA can start covering a lot of different things. And like Justin said, it's how do we get people what they need?
Right. However possible. Yeah. That's great information, that 90s, because that's almost a trigger that they were likely, disabled during service because, like you said, 90% of them came back, in that fashion. So that's really good information. And the spouse question, we get that a lot.
Yeah.
So that's great information. Again, you're far more knowledgeable on the ins and outs, the intricacies of the VA benefits. So we have a nice script that just says, call these folks. In our knowledge, this type of equipment is covered. This type of equipment is covered under this program. There's also if folks have more time to apply, it's more of a 6 months project, but the SAH, the special adaptive housing, that's $100,000 worth of equipment and home modifications, renovations. That's far outside of our scope, but we sometimes will do the vertical platform lift or a stair lift or a barrier-free shower within a giant home project and again, I don't speak on how they're eligible for it, but it's out there as a benefit. So yeah, a lot of variety of things. Something that might be, very near and dear to the hearts of maybe everyone on this call are folks that are on state insurance. It is by far the most challenging funding source that we have available. We are the trailblazers. I can confidently say that we first started the attempt of billing state insurance for our equipment. All of our equipment is foreign or just not on the top of the radar. It's not mainstream. It's gray area as far as insurance goes because Medicare wants nothing to do with it at this time. State insurances, anything that's covered that we've had to, really pave the pathway and work with the third-party billing. It's finally, after years, it's ramps, stair lifts, sometimes vertical platform lifts, and then ceiling lifts we can get covered. We had to work long and hard to carve out a miscellaneous DME code that is recognized because there's no stair lift code, there's no ramp code. We are in talks with high-level folks at the state and would love any of the supervisors or yourselves on the call that have any say in making things happen as far as reimbursement rates and things and creating codes and things like that. We're in the talks with a lot of leaders to get even new codes created for us because there's a wheelchair code. There's a physical therapy code. There's a chiropractor code. There's a walker code. That is the stuff that everybody knows you need. The grab bar code is very different. The grab bar code is written, here's this grab bar. You'll get you'll get $16 back. None of my competition will become providers through the state for that. There's just holes. And we're the voice. And it's not because the state leaders don't care. It's because they don't know and they're ignorant. And it's my job personally to scream it from the rooftops and make changes. So we are in a re-credentialing process right now through Medicare. And the only reason that we have to go through Medicare is because they're, the umbrella of Medicaid. So in order to bill Medicaid, you have to bill Medicare, even though Medicare doesn't cover any of our items. So right now, Navitas, that runs Medicare, is on a backlog. So we submitted our re-credentialing about 90 days ago now, and are still waiting to get that approved. So we have a little of a backlog of NHP and United and even fee for service, the folks that don't have an MCO and only have the anchor card and fee for service. Those folks, we have a backlog of ramps and stair lifts that we're fighting and trying to get approved. There's a variety of pieces of the puzzle for that, but we go through all the steps. It just takes a lot more administrative work than our private pay consumers, and even far more than the state grant as well. But it's
Awesome.
out there. The programs are out there.
That's great. So even individuals who are on Medicaid are able to participate. So it's 10:30.
Yep.
So we've run right to the end. If people have questions, Justin, can you drop your contact
Yes.
information in the
Right.
chat so that
Absolutely.
they can reach out to you? If if people want to hang out for a minute and ask questions, that's cool, but I also want to respect people's time. Justin, I'm so glad you're able to come on today. It there's just so many different ways that people need help.
Yeah, and it's all about options on our end, and there's no right or wrong answer for what we're educating folks on. You know, sometimes handrails help as much as a stair lift would. Sometimes railings to enter the house help as much as the ramp, but it's all about options. So that's what we provide, and we get asked every day. Just about every house we're at, we get asked about, well, what about this and what about that? So we, like you, have a wide variety of resources, you know, other pieces of the puzzle. So don't be shy, you know, ask away because we're very highly educated in this field and we really embrace it.
Awesome.
Right.
All right. Well, thank you so much, Justin. I appreciate you coming on. It looks like folks don't have a lot of questions that they want to
Okay.
speak up about. So I will bid you all adieu.
All right. Thanks
All
for
right.
having us.